All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt. Your doctors are busy, your pharmacists are busy. They don't have time for this hour. I do. So call in with those questions and those comments. We're going to get right back into your calls. Line 5, we've got Joseph. Joseph, welcome to Pharmacist on Call. How may we help you?
Mr. Pruitt, I thank you so much for the show. I am 72 years old and been for over a year for BPH taking dioxazine and, if I pronounce this right, finasteride or something like that.
Finasteride, yes, sir.
All right, you're familiar with both of those, I guess.
Mm-hmm.
Correct?
Sir?
You're familiar with both of those?
Yes, sir. Yes, sir.
And so I'm wondering, there's a separate one other than dioxazine called terazocin, used for the same purpose.
Yeah, brand name Cardura. Yes, sir.
Is one of those any better than the others? Let me say this. What I'm taking, I've been taking it for over a year, and it helped, especially in the beginning. But for the last 6 or 7 months, it doesn't seem to have made any further progress. And so I'm just wondering.
So describe to me what you notice in terms of your change in your symptoms.
Well, I don't have to use the bathroom near as frequently.
Okay.
But the bladder never seems to be totally emptied out, and that's the main problem.
Yeah, yeah. And so what these drugs do is they relax the prostate, they decrease because there's hypertension in the prostate area. So what they do is they lower the blood pressure, allow the bladder to relax and open up the vessels, so when you do urinate, they take that pressure off of the prostate. So once the urine comes through, you're able to empty your bladder fully. Now, to answer your question, are one of these drugs better than the other? That actually depends on you and your genetic makeup. So we would have to determine, I guess by trial and error, which of these medications would be good for you, because for all we know, you may be a person who rapidly metabolizes certain types of drugs, or you may metabolize. So if you do that, this drug will only work 6 hours, where it is designed in another person to work 12 hours. You follow me? So something you could add on with that is maybe saw palmetto, which is an herb that I take.
Familiar with that, and I take a couple of tablets, which is not that many milligrams per day, but that hasn't seemed to make any difference. Maybe I'm just not taking enough of the
What milligram are you on? The saw palmetto, what milligram are you? How many milligrams are you taking?
I can't recall exactly. I don't have that in front of me. But again, I just take two tablets in the morning, and it's I don't know, maybe 250 or 300 milligrams each.
Okay. Are you having to get up at night and go to the bathroom?
I am, yes.
I'll take two about an hour or so before you go to bed.
Okay.
You get your good night's sleep.
Okay, good. All right, well, that helps a lot. Thank you so much.
Yes, sir. Thank you. All right. All right. Looks like we've got John, line 1. Welcome to Pharmacist on Call. How may we help you? So, John?
Hello?
Yes, sir. Welcome to Pharmacist on Call. How may we help you?
I wanted to get your opinion on Botox. The reason is my hands, they will shake. Not so much like Parkinson's disease, but like if I eat or do something, then they'll shake. And somebody said that Botox might do something for that. I don't know, but I just wanted to get your opinion and if there's any side effects. And if it's all right, I'm going to go ahead, hang the phone up and listen to you on TV. This is a long-distance phone call.
Oh, okay. Well, hey, I'll just go ahead and tell you right now while you're online, I'm not up on Botox. Let me research it and give me a call, or I'll mention it and go in depth on the next show, if that's fine.
Okay.
Yeah, so we'll mention that, Botox and trimmers. Okay, or you can just give me a call at the store. The number is up, will be flashed by the producer at the end of the show, and then we'll have a discussion about it.
All right, well, thanks.
Yes, sir, thank you. Okay. Line 2, Thelma, welcome to Pharmacist-on-Call. How may we help you?
Well, hello, dear.
How you doing?
I'm just fine. How are you?
Oh, pretty good. How may we help you today?
You can call me Mom if you want to.
Okay. How may we help you, Mama?
I have a question about Lyrica. You know, that is prescribed for nerve ending problems.
Yes, ma'am.
And it has a certain side effect. I'd like to know what the psychiatric side effects are, and if you have something that is natural or holistic that can counteract some of the side effects of Lyrica.
Well, the Lyrica is, so for those of you who are not familiar with it, it's the #1 health concern that we talk about on this show. And I'll just put you on hold here, ma'am.
Okay, dear.
Mama. Okay. And so it's the #1 health concern. They use it to treat neuropathy, and whoever comes up with a treatment or a real cure, you're going to be a wealthy person. So what Lyrica, the side effects, my patients have told me anything from hallucinations to suicidal or homicidal ideation or just brain fog. So a number of different things, but they clearly can't take it. And so for them, we recommend they go to gabapentin. But some patients will also say the same thing about gabapentin. So, whichever one doesn't give you the psychiatric side effects is probably what you should stick with. In terms of something that would counteract those, I can't think of anything offhand. I think the body is just going to have to process the drug out of the system, and then you just have to stay off of it. But unfortunately, those, are, to my knowledge, are going to be your only 2 treatments for neuropathy. So, hope that answers your question, Mama. And because we'll holler at you later there. All right. It looks like we've got on line 3, Chris. Welcome to Pharmacist-on-Call. How may we help you?
Yes, you have actually just answered it. I take Neurontin, gabapentin, and I was going to see if there is anything that is better or worse. I have a tendency to have weakness with the gabapentin as one of the side effects. However, if the Lyrica is doing what you just said, I definitely don't want that. So I didn't know.
Well, again, as I cautioned the guy 2 callers up before, your genetic makeup may be such that it will not give you those psychiatric side effects. So we have to remember with drugs, just because it gives it to me does not mean that you will have that side effect. So drugs are, they're not all cookie cutter for everyone. Everyone is kind of different in terms of the genetic makeup, and that's going to affect whether or not you get side effects, how long the drug works in you. So you follow me?
Yes, sir. Is the Lyrica compatible with oxycodone?
If you get relief, yes, but no, it's not a Schedule II narcotic in that sense. It's actually probably closely related to the Valium family.
No, I mean, can you take them with each other is what I was trying to get at.
Well, you're going to get some increased CNS depression or drowsiness, but gee, gabapentin does that to you too.
Yes, it does.
Yeah, so, and I think that's dose dependent, so I'm not sure what milligram you're on.
300 3 times a day.
300 3 times a day. Compared to what I see, that's kind of a mid-range dose.
Okay.
So I see people who take much more than that, and they're able to function properly. It's just really strange. I can remember my ex-wife taking 100 milligrams, and gosh, it had her out all day, just one capsule. So everyone's genetic makeup is different in terms of how they process drugs, how the drugs affect them. So it looks like, but is it working in terms of your neuropathy?
Yes, it is.
Okay. Then with that, I probably kind of grin and bear that side effect. The Lyrica is going to make you sleepy too, but ask your doctor if he thinks it's worth a try.
Okay.
Or she.
I was going to tell you also, thank you for your show, and you do a great job. Thank you.
Yes, sir. All right, thank you. All right, we've got Kelly, line 4. Welcome to Pharmacist-on-Call. How may we help you?
Hi, Hi. I have epilepsy, and I also have degenerative bone disease
Yes, ma'am.
in my arms. That's really starting to affect my, I guess, life, the way I do things.
Yes, ma'am.
And my doctor has put me on Norco 10. She has raised me from 7.5 to 10
Okay.
every 6 hours.
Mm-hmm.
Okay, I'm having a lot of breakthrough pain with those. What can I take safely, because there's already a lot of Tylenol in them, and I have a habit for GI bleed, so I can't take any NSAIDs, and I'm afraid to take Tylenol on top of my Norco.
Well, this is one of those cases where I think you're going to need to be on a long-acting narcotic medication, something without Tylenol. So you could go extended-release morphine, which is MS-Contin.
I'm allergic to it.
Ma'am?
I'm allergic to it.
You're allergic to morphine. So then you could go the oxymorphone route. Brand name is Opana, if you've ever heard of it.
No, I haven't.
Okay, so that is an option for you, and OxyContin, which is an extended release oxycodone. And actually, I believe if that hydrocodone works for you, there's a new drug out. It's an extended release hydrocodone. It's called Hysingla, Hysingla.
Okay, well, I'm trying to get him to send me to a pain clinic.
Yes, ma'am. I think that's going to be the route that you need to go.
I believe that's what I have to do. My husband's been mentioning it, but he just wants to do it himself, I believe.
That is the route you need to go.
There's going to be more. He's going to have to send me to one.
Yeah, because your primary, he's going to be under pressure from the powers that be not to write for too many narcotics. But the pain clinic, that is their specialty, and they're also going to be a little more understanding of your pain needs than say your primary care physician.
Yeah,
sounds like you got some.
Epilepsy does hurt. People don't know that, but epilepsy hurts.
Yeah, and I'm sure you do some spasming as well. They have you on baclofen.
Yeah. But alrighty then. But there's nothing over the counter I can take them for the breakthrough besides Tylenol.
No, ma'am. You're going to have to go heavy duty. So.
Okay.
Yes, ma'am.
Alrighty then.
Okay. All right. Good luck, Kelly.
Thank you.
Yes, ma'am. Thank you.
Bye-bye.
All righty. Bye-bye. All right, everyone. Stay right there. We will be right back. Call in.